I'm Lisa. I'm with the SHARE project here in Haywood County, and this is kind of a second part follow-up video with Nicole Ross, who is with Behavioral Health Group Recovery in Haywood County. If you missed the first part of our video, of course, you can find the link. I'll put that in the description. As far as a recovery center and treatment center here in Haywood County. But Nicole specializes in dealing with pregnant moms who are looking for treatment but don't know if it's the right thing to do because they're pregnant. And what does that look like? What does that look like through all the way through pregnancy on into delivery? Is it going to hurt my baby? All those kinds of things. So we thought we would do a short little follow-up video. She is going to just take it away. I got no questions. So she's just going to kind of give us just, a little bit, enough information that you can feel a little bit of sense of knowledge, at least what that might look like and whether or not it's an option for you. So
absolutely. So the term that we use for dealing with maternal mom, it's perinatal substance use. So it's a little different than regular substance use disorder because abstinence is not our goal. With perinatal substance use disorder, there's this idea that if mom uses opiates while she is pregnant, the baby's going to be born addicted. So I want to step back from that, because the first thing I want you to hear me say is that there is no such thing as addicted babies. There are exposed babies, but there's no such thing as an addicted baby. Addiction is a whole gamut that includes a piece of choice, and babies cannot make that. So there are, what we refer to is neonatal abstinence syndrome. And that's important. I want to hit the A in that NAS, because the risk to the fetus, to the baby, is not coming from mom's use. The biggest risk perinatally is withdrawal for the baby. Okay. So when we have a mom who comes and says, hey, in my first trimester, I just found out I'm pregnant, I'm using this much heroin a week, and I'm trying to wean down. And so our first thing is, let's stop and get her stable on a safe methadone or buprenorphine dose so that baby does not feel any of the withdrawal effects, because that is where the harm to baby comes from. Now with other substances, it's a little different. Alcohol, obviously, we shoot for abstinence, like the less we can get. Same with methamphetamines, cocaine, other stimulants. But opiates are a different thing, and they affect baby differently. The other myth I hear a lot is if I'm on a high dose, then my baby's going to have a higher chance of neonatal abstinence syndrome, which is just not true. There's a certain percentage of babies who are exposed to opiates during pregnancy who will experience neonatal abstinence syndrome and may need a short NICU stay. It's excessive crying, agitation, things like that, most of which now are treated with methods like Eat, Sleep, Console. So they're going to put baby super close to mom, skin to skin as much as possible, have baby nurse, especially if mom is still on methadone or Subutex, so that can get in baby's bloodstream too, because that's the safest way. Okay. So a lot of times baby won't even need any medical intervention. Sometimes baby will. But the crazy thing is that a higher dose of MAT does not equal a higher rate of NAS. So when people come and they're like, now we just need to titrate down, we need to get all the way off of this. I'm like, maybe, let's wait and see what you and baby need. Let's see what you feel comfortable at, what you are not experiencing withdrawal at, because if you're experiencing it, baby is experiencing it. And that's where the rub lies. So perinatal substance use is a different thing than regular substance use. So we have to look at that whole picture. And so the first thing we're going to do with a mom who comes in and says, hey, I'm using and I'm pregnant, we're going to say, great, let's find you an OB. Let's find you an OBGYN so that we can start coordinating care. A lot of times those are done through MAHEC, through their perinatal substance use disorder clinic, and then we coordinate care with them. And then it's the same thing that we're going to do for anybody else, times two. So we're going to work with setting them up with social supports. We're going to help get those nets of recovery safe and supported. And this time we've got a time frame. Yeah. So it's not like when we're having someone else define their recovery. What does this look like to you? What does this look like to you? With perinatal work, we've got a time frame. And if a mom comes to us at 30 weeks, we've got a short time frame to get a lot done. So lots of times her care team will have 3 clinicians on it. Like, we're gonna hit her with all the therapists that she needs, a social worker. And then we're gonna coordinate services with places, like a lot of OBs now have in-house supports for this kind of thing. But if they don't.
Okay, I was gonna ask that. Do you find that obstetricians are, there's a select few that are willing to take on this, or is it becoming more?
It's becoming more and more. I'll tell you, the OB field has surprised me because they have rallied and said, you know what, we want to learn. And so Project CARE, which is run through MAHEC, now has a designation that OB providers can give. Like, hey, I'm a Project CARE provider, which means caring and advocacy, respect, and empowerment. So the plan is, if they see, oh, that's a safe person for me. This is a person who's going to treat me with respect. They have providers now in Jackson County, Haywood, Buncombe, Swain. I was pretty proud of that one. Of providers who say, yes, we get that this is an issue and we get that this is hard to talk about, but we want to be safe places for you to say
that is impressive.
Perinatal work, really.
I am very impressed with that.
Because the biggest thing is that we want mom to see that we are here to support baby, but also we're here to support her, not just as a host for baby. And I think that a lot of times that model of care earlier came from, okay, we're going to keep you safe, but only because you're housing baby. No mother uses substances because they don't love their children. That doesn't have a thing to do about it. It has everything to do with they are a mother and they also use substances. It doesn't have anything to do with their level of love for their children. One of the myths we hear a lot is if they love their baby, they'd stop using.
Oh boy,
I mean, sure, but if it were that easy and they had a choice, it wouldn't be substance use disorder. It would just be something you could just click on and off. In which case we would all be out of a job and I would be happy to scoop frozen yogurt. But it's not. It doesn't have anything to do with their level of love or their desire to change. It's a physical alteration in their brain that the more we can build in these cultures of support, the safer they are.
So there is no reason. No reason for a pregnant mom not to seek.
Yes, absolutely. Absolutely. There are enough providers now that are safe, compassionate OB providers. So when you go in and you say, hey, I'm pregnant and I'm also using drugs, that we can rally teams around you.
Well, that's awesome. And that is spreading hope there.
Perinatal work is the most hopeful.
Yes, that's great. That's great. All right.
Anything
else on that?
Nope. I think I'm good.
Thank you very much, Nicole.
Absolutely. Thank you.